Saglit lang. Good day, we are Group 5 from PT1C and we will be presenting a grand case discussion. Next slide. The case that was given to us is a 32-year-old professional male basketball athlete who felt immediate pain and weakness over his right shoulder upon impact of another player's hand during the shot. The patient stated that he heard a popping sound over the right shoulder. He was diagnosed with a rotator cuff tear and was referred to rehabilitation. Next slide. The following questions are what we aim to discuss throughout the presentation. Next slide. First, we'll discuss the mechanism of the injury. Next slide. To understand better, it is important to note that the anatomy of the shoulder joint. The shoulder joint is a synovial joint which makes it the most mobile in the body. The synovial membrane lines the inner surface of the joint capsule and produces synovial fluid to reduce friction between the articular surfaces. The shoulder consists of bones, joints, ligaments, tendons, and muscles, which will be further discussed on the next slides. Next slide, please. The bones of the shoulder include the humerus, scapula, and clavicle. Next slide. The two main joints relevant for this case is the glenohumeral joint and the acromioclavicular joint, both of which help mobilize and attach the bones together. The glenohumeral joint is the main joint of the shoulder. It is a shallow socket where the head of the humerus articulates with. The acromioclavicular joint is a plain synovial joint and is where the acromion of the scapula articulates with the clavicle. Next slide, please.
Now, for the ligaments of the shoulder, the joint capsule is formed by a group of ligaments that connect the humerus to the glenoid. They hold the shoulder joint in place to prevent dislocation. Next, we have the coroclavicular ligament, is composed of the conoid and trapezoid ligaments as it spans from the coracoid process to the clavicle. Its function is to maintain and position of the clavicle in conjunction with the acromioclavicular ligament, and while the glenoid labrum, a fibrocartilaginous ridge surrounding the glenoid cavity, deepens the cavity, creates a seal with the head of the humerus. Primarily, this is also where the bicep tendon attaches to the glenoid. Next slide. Now, the tendons of the shoulder consist of primarily two tendons: the biceps tendon, which runs from the bicep muscles to the anterior portion of the humerus until the superior part of the glenoid and the rotator cuff muscles. It comprises four tendon muscles, which are the subscapularis, teres minor, supraspinatus, and infraspinatus. And before attaching, they form a single tendon called the rotator cuff. Next slide. These are the muscles of the rotator cuff. The supraspinatus muscle is one of the musculotendinous support structures of the rotator cuff that enclose the shoulder. It helps resist inferior gravitational forces placed in the shoulder joint. Next, the subscapularis is the largest component of the posterior wall of the axilla, which prevents the anterior dislocation of the humerus during abduction and medially rotates the humerus. The subscapularis is also the only muscle of the rotator cuff that is not a rotator of the humerus. Next, the infraspinatus is a powerful lateral rotator of the humerus. The tendon of this muscle is sometimes separated from the capsule of the glenohumeral joint by a bursa. And lastly, the teres minor is deep to the deltoid muscle, which stabilizes the ball and socket glenohumeral joint by helping hold the humeral head into the shallow glenoid cavity of the scapula. The teres minor laterally or externally rotates the arm at the shoulder joint, and all the tendons work together to stabilize the joint, rotate the shoulder, and lift the arm above the head.
What is a rotator cuff tear? A rotator cuff tear is identified when one or more of the rotator cuff muscles begin to inflame or is already torn and the tendon no longer fully attaches to the head of the humerus. Next slide, please. There are two types of rotator cuff tears. The partial tear, also called an incomplete tear, damages the tendon but does not completely sever it, while a full thickness tear, or a complete tear, separates all the tendon from the bone. With a full thickness tear, there is basically a hole in the tendon. Next slide, please. The most common muscle The most common muscle that is torn is the supraspinatus. It is also the most commonly injured rotator cuff muscle because of its location and insertion to the head of the humerus. The tendon of the muscle extends laterally, passing under the acromion process and over the head of the humerus, blending into the glenohumeral joint capsule to insert on the superior facet of the greater tuberosity of the humerus. The supraspinatus initiates abduction, which exposes it to friction and pressure against the acromion, causing impingement of the supraspinatus on the acromion bone. Next slide. The rotator cuff tears can be further divided into five categories. First, type A is a tear in the supraspinatus and superior subscapularis. Next, type B is a tear in the supraspinatus and the entire subscapularis. And type C happens in the supraspinatus, superior subscapularis, and infraspinatus. Type D occurs in the supraspinatus and infraspinatus. And lastly, type E is a tear in the supraspinatus, infraspinatus, and teres minor. Next slide.
To confirm the diagnosis, the following tests will be performed, namely physical examination, provocative testing, and imaging testing. Next slide. Firstly, for physical examination, the indications of tear are identified through merely inspection and palpation. For testing of range of motion, it is important to compare the affected extremity with the unaffected one to determine the patient's normal range. This test, especially with active motion, most likely suggests muscle weakness rather than joint disease. Next slide. Provocative testing generally provides more focused evaluation for specific problems and are typically performed after the history and general examination have been completed. Next slide.
The drop arm test is performed to identify rotator cuff tears by passively abducting the patient's shoulder, then observing as the patient slowly lowers the arm to the waist. The patient may be able to lower the arm slowly to 90 degrees, but will not be able to continue the maneuver as far as the waist. Next, for the clunk sign, this test is performed when the patient's arm is rotated and loaded with force applied from extension through a forward flexion. A clunk sound or clicking sensation can indicate a glenoid labrum tear even without instability. Next slide, please.
Now, in diagnosing a patient, physicians frequently order diagnostic scans such as an X ray, ultrasound, or MRI to confirm their diagnosis. These tests can also assist in decisions regarding treatment and future care of the issue. Next slide. For musculoskeletal ultrasound imaging, as shown in the PowerPoint, the ultrasound has the advantage over MRI for it has the ability to image tendons and ligaments dynamically, allowing visualization from different angles and under stress. It is widely used for the assessment of tendon and ligament abnormalities. Next. As for X-ray, it does not show soft tissues, but this test rules out fracture and osteoarthritis cases which can be indicated by the presence of bone spurs. Next. Lastly, for MRI or magnetic resonance imaging, this test will show a detailed view of the soft tissue around the shoulder and it can see the tearing of the rotator cuff that is indicated by accumulation of fluid around the area, thus identifying muscle tear cases.
Next slide. How does the patient's occupation affect his condition? The patient's condition may compromise his career depending on the gravity of the tear and the pain felt. If the results show no severe tear on the tendons, then he may rest and be treated at home for a few days or weeks, then be able to go back to playing once his rotator cuff is fully healed. Although it must be noted that the athlete is already near the age of 40, which can mean slower regenerative process of the muscles. Therefore, if the results show severe muscle tearing, he must seek for professional help and undergo surgery. After surgery, a long healing process is needed for full recovery. But after the treatment is given and it still occurs, the patient may not be able to go back to playing the sport. Next slide. Thank you for listening, and we are now open to answering your questions.